It's Friday. Let's just get right into it in our KUM News Zoom room. We have from the Department of Public Health and Social Services, Chiwa Mbakwem, who, Chima, like I said, you got a long title. I just like to say you're the containment lead for the COVID-19 pandemic for public health. That works, right?
Yes, yes.
Good morning.
Morning.
Thanks for joining us.
Oh, that's what I was going to say. I was going to say thanks for coming on the show.
Let's just get right into it. Chima, if you could just, layman's terms, describe your responsibilities in this COVID-19 pandemic, just for those people out there who don't know what containment lead means.
Okay. My role basically is to mitigate and contain the virus at the point of testing. So what I do is I have a team of individuals that manage the isolation and quarantine team at quarantine and infection control. We also have the records team. What we do in the quarantine team is basically quarantine implementation and quarantine monitoring. And also for isolation, we also have isolation implementation and monitoring too. Then for the records section, what we do is make sure that we provide guidance and for the records unit, we're responsible for collecting all information, pertaining to individuals that are either quarantined or isolated. So that's what we do in our unit.
Well, with the numbers that we're seeing, the surge, how do you think you've been doing?
I think we were doing pretty okay until we had the surge, but nothing changed on our own side, because what we're doing is what we're supposed to do, make sure that we try to isolate people who are positive, make sure that their close contacts are quarantined, make sure that we try to do our symptom monitoring for those who are in quarantine in case they develop symptoms and refer them to be tested. So we're doing what we're doing, just that we have more numbers, and I'm sure we're still doing okay.
Right, and when we saw early on before the surge, much was made about the number of cases that we caught in quarantine, right? But lately it seems like, and it is like every case we're getting is from community spread.
So we just have to take a step back and look at what happened in June. When we gradually opened our island, people who came in from other parts of the country, people who came home for funerals, people who came home for vacation, And if you look at the numbers out there at that time, there was an increasing number of cases back stateside. And then, when these people came with our relaxed policy at that point, people actually went straight home without being quarantined, So we lost that stopgap that we had initially, and people got into the community. And for us, we were also monitoring them, because the system was, if you come in with a positive test result, you go home, after 7 days you test out, or you end up in the quarantine, after 10 days you test out. But what we saw was a lot of non-compliant issues, because people who came into the island, were supposed to be local residents, but with my team, what we noticed, which we documented, was we had an increase on non-compliant cases, and these are people who gave wrong addresses, incomplete phone numbers, so it was difficult tracing them. And with the funerals and gatherings that happened within that short period, that is what got us to where we are right now.
Wow.
Right, but we're gonna the discussions we've heard are we're gonna go back to this 7-day test out from quarantine, but with you have to download this Sarah Alert app. Are we sure that this is going to work?
Yeah, because you just kind of upsold the stopgap measure, and I mean, like you said, we're in this surge. So is that a wise move?
Yeah, but with Sarah Alert is the monitoring is a lot easier, because you have to pre-register before you come into the island. So, and at the point of entry, we were going to verify, the address you gave us, the phone number, the email you gave us, because you're going to get a code to activate it. So if you don't get a code to activate it, then that means the information you gave is wrong. So Sarah Alert can actually help us more, capturing that compliance issue that we have.
What are your what's your response to those who say, why can't we just test people when they come in to the airport?
I can't give you a straight answer because that is still being discussed, at different levels, to see how viable it is for us to do that. It is an option, but we have to be very careful, when making such decisions. And that is what the team is actually sitting down. We've been working, our team has been working with other stakeholders, to really look at it critically and make sure that if we're going to do that, we're going to do it right. And also make sure that we do it properly. Let's just put it like that.
I mean, from a containment standpoint, though, is it a move that would make sense? Because that's what they do in the CNMI, and the CNMI is sitting pretty right now.
I always go back to individual responsibilities when people discuss about public health, because at the most, it depends on the individual to comply. We have those strategies out there. We have the educational materials out there. We consistently put out reminders, but it's on the side of the individual. If we go that route, we are hoping that the individual would also help support, help us, achieve what we want to achieve, and that would keep the island safe.
Mm-hmm. You talked about, people who weren't following quarantine, home quarantine, right? What about the exceptions that are made for people that come into Guam and are allowed to just totally bypass quarantine and just go about their business? And then later on you hear, oh, well, they got COVID and they gave it to somebody else. I mean, how is that fair and how is that right?
So I need to understand the question, like you said. When
how
they
are
come
exceptions made to people who get to come into Guam and not have to quarantine? How are those exceptions determined?
Right, because at first we heard it was just for essential personnel like doctors, but then we're hearing people like Marcel Camacho skipped on quarantine because he's claiming to be a farmer. So it just appears that there's no real rhyme or reason. I mean, I can understand a doctor or a nurse, essential frontline personnel. I get that. But
so I think when you're trying to define essential, you really have to take time to understand what is essential at this point in time. So without addressing the case you presented, I didn't make that judgment. But at the same time, you're looking at someone who, assuming you have someone who is a medical doctor, and someone who is an accounts clerk in the hospital, or a frontline, or a pharmacist. At this point, you're going to make your determination based on what they are going to do at this point in the pandemic.
Right.
A doctor is essential in the sense that they're going to treat patients who are sick, but the accountant can remotely work from home. So if the accountant comes in and he's placed in home quarantine, he can also work remotely from home quarantine, like a lot of people are doing. Yeah. And looking at the farmer too, looking at the farmer and their role in the community, growing food for us to eat here now, if it's not deemed essential at this point, then it becomes a challenge, if he's in quarantine and then his crops will rot away, or he doesn't have anybody to tend to his crops. I'm just trying to balance the assumption that those determinations are made independently.
Who makes those calls though, Chima? Is that you? Because it kind of seems like it would be your call as the containment lead, or is it someone? Is it Adelup?
No, so it has nothing to do with Adelup. There's a process in public health. There's on the website. You put in your request. For exemption, and the team would look at the merits and then make a decision based on the information available to them.
Right, and I just want to, because I talked to Marcel yesterday, and he actually got his bona fide farmer certification on August 7th, so a little more than a month ago. And when I was talking to him, because I just thought it was kind of, I told him, I go, it's kind of funny, you as a farmer, like, I don't buy it. And he said, oh, I'm hoping to farm 18 acres. So I'm just thinking, like, if this guy is hoping to farm, I don't see how it's essential. And I got a friend who's got a 2-year-old baby in quarantine sitting there for 14 days, and we're letting someone who's claiming to be a farmer but whose hands are probably softer than a baby's butt go free. You see what I'm saying, Chima? It just doesn't make sense on the optics of it. And I get what you're saying is that, people, I mean, the idea was that, oh, this guy's got crops and he's going to feed the island and we got to get him out there to harvest that. But it's just, to me, a tough sell.
So, Chris, like I said, those determinations are made based on the facts that we have in front of us, Yeah. So, yes. So whatever facts we have, will determine what decisions that are made. And we try to balance all sides, before we make those decisions.
So aside from the quarantine, do you also help contain what's happening outside of quarantine in terms of COVID? Because I don't think a majority of the cases right now are coming from the quarantine facilities. It seems like it's so out there in the community. What are we doing to contain it there?
So I think, what most people, like the emphasis has been on the quarantine site. Mm-hmm. That is not what my unit does. We're actually the containment team for the response. So we manage the people at home. We manage the people in the ISO facility. So we actually run the isolation facility. We run the isolation. We manage the QFAC. We manage people in home quarantine. Right. So I have a team. Public Health has a team in the quarantine site, which is a team of social workers. We have a psychologist there. We have public health staff there that takes care of the quarantine site. At the ITC building, we have another team that manages people on home quarantine. So these are close contacts to positive cases. These are people that might have been exposed at some point in the community. We also handle that from there. We have a team at the isolation facility, a team of nurses that actually take care of people who are in isolation, in these isolation facilities. And we also have a team at ITC that manages people who are in home isolation. So it is a unit that manages quarantine and isolation for the whole response.
Right.
So who's monitoring the people that are in home isolation, that aren't in the consolidated isolation facilities? That's somebody else?
Yeah, there's a team. So we have teams. There's a team at ITC that is managing people at home.
On home isolation.
Right.
Okay.
Yes.
Yeah. And Chima, how would you say the isolation facility? Because we hear a lot about the quarantine, right? But the ISO fact, we don't really hear so much about. So how many people are currently in the ISO facility?
I can't give you a number offhand, but at least like 50, like around the 50s or 60s now.
Right.
But the concept of the ISO facility is it was designed, to support families, multi-generational families, people who do not have safe housing.
Right.
Like how our community is. You can have a positive case in a multi-generational home that is not conducive. The ISOFAC is a stopgap to take them away, to reduce infection in the family unit, at the same time take care of the individual.
And it kind of seems like, just given our poverty rates here on Guam, that a lot of people who are positive might not have I don't have a way to self-quarantine or isolate at home because I don't have the separate bathroom. And that's mostly what the people in the ISOFACs, that's kind of where they're coming from, right?
Yes, we support them there. And another thing is, for the disease, this is an equal opportunities disease. It is not like a lifestyle disease, where you have to, do some kind of thing to get the virus. This is an equal opportunities disease. It does not know poor, it does not know rich. It is a virus that can affect anybody who comes in close contact to someone who has the virus. So when we keep that at the back of our mind, it gives us a clear picture of what we're dealing with.
Right. And I just wanted to go back to the whole home isolation and who's monitoring and how are you guys monitoring people? Because we hear that, it's contact tracing. They were in contact with somebody who was infected, et cetera. So what are we doing to ensure that people that are in home isolation are actually isolating? So they're not continuing, or this is not, spread throughout the community, which it already is. I mean, 88 people yesterday?
Yeah. Yeah, Chima, because I feel like if I'm positive and you guys are like, hey, do you have a bathroom at your house that, you can self-isolate? And I'm knowing that, if I say no, I'm going to go into the ISO facility. I'm probably going to be like, oh, yeah.
I know. I mean, is our best defense is like, let's hold an hour and a half press conference on the Guam COVID Alert app, go download it? I mean, really? That's the best we can do?
No, I think what has happened is that for the past 6 to 8 months that we've started this response, nobody has actually looked at what the containment team has been able to achieve. If you look at our recovery rate, if you look at our not what is happening in the past 3 weeks, if you look at what's been happening since March, if you look at the number of hospitalization, if you look at the number of people in the ISOFAC and compare it to the number of people who have been in home isolation, who were successfully isolated and recovered, then you understand clearly what the containment team has been doing. The process is clear on what we do. When we have a laboratory confirmed case, the individual is notified, and a team would have a set of questions that they ask them about home suitability. So if you have a suitable home, we have a team of nurses and social workers that provide wraparound service. The nurses go to the home to issue the initial package. By that, they identify your home, know what kind of family structure you have, and then you're followed up with the social workers who provide wraparound service for people, because when you're basically in isolation, your family is quarantined. Mm-hmm. So you need wraparound service because you can't leave the house. Mm-hmm. So we have that team. We also have support from the probation office and the AG's office. These are our compliance officers. They go out every day because we have a system where we try to reach out to these individuals twice a day by phone calls. And if we have a non-compliant case, this team will go out to the home to make sure that those people are properly isolated. So this is a system that has worked perfectly well. We drove down the numbers until we had this surge, right, which we can actually point out to what happened.
Yeah.
Mm-hmm. Well, really appreciate what your team's doing, and for the simple fact that you guys are putting your lives on the line,
right,
going out there, risking exposure. Yeah. Has any members of your team turned up positive for COVID?
Funny that you asked that, Sabrina.
It's interesting that I'm the only one in the whole team that has turned positive. It's interesting to know. And the fact that
what did you do, Chima?
Chima, so
what did you do?
What'd you do? What'd you touch, man?
Okay, so we conduct the initial face-to-face assessment. We provide face-to-face direction, So that will tell you the level of risk my team takes. But if you're looking at the period when I got infected, it will tell you that all the precautions that I took, all the effort I put in protecting my family caved in when we opened up the island. Because my kids started going out, my family started mixing up with other people. Since March of this year, I have a protocol when I come home. The kids don't touch me. The dogs don't even come to me. I go straight, take a shower, I have a room in the house where I have been quarantining since March. But when the island opened, the kids started coming to me. We all felt relaxed, right. But at work, we still have those same protocols. And you can imagine, when I turned positive, everybody that walked around me, from the director's office to the quarantine team in ITC, the isolation team, the lab, the ISO, or the quarantine facilities, every single member was tested and none came positive. But my family turned out positive, the 5 of us.
And so with your own contact trace, you're able to determine that you got the virus from your kids, is what you're saying?
So that is what I'm trying to explain, that, the fact that when the lockdown ended, people started going around, doing the normal things they were doing, right? So all the safeguards that I had in place at the workplace still worked for me, but at home it failed me. It could have been me, or it could have been who my kids made contact with, because what was interesting is that we have a babysitter that takes care of my kids. She was positive, and during contact tracing, no member of her family tested positive. So she contracted it in my house.
I see. Yeah.
Can you tell us a little bit about this case we saw with the numbers that were reported last night about the construction workers?
I don't. Yeah, we've been hearing about something at a barracks for construction workers. Do you know? Can you give us any information on what exactly is happening with that?
From a containment standpoint?
No, like at this point, we're still investigating and trying to isolate and quarantine the individuals. So I can't provide information now, but what I can tell you is that the positive individuals are properly isolated. The contacts are quarantined, and the mitigation plan has worked, and we're sure we've stopped infection in that place. And the good thing is a cluster, so it's easy for us, we identified the cluster, we're able to shut it down, and then did the testing. The turnaround time was okay, and I think right now that is taken care of.
When was that reported? This cluster. When did you guys learn of what was happening at this location?
I have to give credit to the contact investigation team. You cannot identify a cluster without an index case.
Mm-hmm.
So there was an index case, that was tested, and the team went in and interviewed the contact. And that sprung up all these activities. From that index case, they identified that there were other people that were close contacts. They were tested and they were found to be positive, and then they've been successfully isolated and then quarantined. So that is just the process.
So
Right. How many again did you say the positives?
55 or
the numbers should be in the jig.
yeah, I think it's 55. But Chima, so we allowed construction this whole time. It's still being allowed. It's considered essential. Now that we've had this case where, dozens of construction workers infected in a barracks. I'm sure that, that just seems like a right breeding ground for transmission of the virus. Are we now looking at other construction companies? Are we looking at, hey, do we need to kind of settle down on the construction until we kind of get a hold on it? Or is it just business as usual, full steam ahead?
I think I'll start by explaining the bubble-to-bubble approach. We need to understand the bubble-to-bubble approach, because, for this case clearly shows that in a bubble, you can have a case in a bubble and also be able to contain it in that bubble. So with the construction workers, they work in a bubble, they live in a barrack, and public health actually goes to these barracks, to look at infection control protocols in place in these barracks. And then at the same time, they have, and also, they have a bubble to bubble system. So they travel as a group to the project sites. When they're done, they come back to their barracks. So this process works, but like every other human thing, there's an error. There could be an error, but public health was swift enough to identify this, and we've been able to contain it. And we'll also progressively look at ways to make it better. This is one case, and where the public health is actually looking at or reviewing, the infection control structures in all these barracks, to make sure that they are in line with public health and CDC recommendations.
Right. Can we just go back before we let you go, Chima? The quarantine, the protocol for people who are traveling with young children. Now, we interviewed a woman who was traveling with a 6-month-old baby. Remember?
Yes.
Christine. And
she was cleared to leave the quarantine facility, but then she was stopped and said, "Oh no, now your 6-month-old baby needs to be tested for COVID-19." And she was like, "Well, where does that say that I need to be tested for COVID-19?" And then the guidelines were provided to her, but the guidelines weren't clear to her in terms of like I want to say the definition of a minor. And I think it was like 5 years old or something.
Yeah.
Like I can't really remember the specific details because I don't have the guidelines in front of me.
But I'm just saying, like,
the spokesperson Janella Carrera was saying that, oh yeah, they need to clarify the guidelines when it comes to babies and minors and so forth.
Right. I'm just saying, like, if we're gonna let out pretend farmers, why can't we also be as compassionate with parents who are traveling with young kids, right? Because I mean, can you imagine being stuck in freaking quarantine for 14 days with a 2-year-old?
So for you to be released from the quarantine site, there's a protocol. You have to have a room in place, for those essential workers. But for the case you brought up, there's this issue about public health and public trust, And at this point, the most important thing for us to understand is that trust is what matters at this point. Mm-hmm. It is not about fighting the recommendations of public health. The isolated case you just mentioned, is about the woman who did not understand why public health wanted to test her 1-year-old baby. But at the same time, we can tell you that in the quarantine sites, we've had I think a 12-month-old baby test positive. We've had another case of like a young someone who is less than 2 years test positive. So these things are COVID is like a moving target, and we keep adjusting. So I think when those judgment calls are made by the medical team, there's a medical team in the quarantine site that actually makes those determinations based on what the medical director feels or based on what is presented to her and her judgment. Is not on us, but it's on the medical director to make those decisions. And when those decisions are made, we try to ensure that they are carried out. And so this is one of those isolated cases where we're looking at it from one side, without looking at what the medical informed the medical decision at that point. So it's just an isolated case that the medical doctor, the medical director made a determination based on what was presented to her.
All right. Thanks a lot, Chima, for your time and coming on the show.
Yeah, it went so
Really
fast,
appreciate it,
Chima.
yeah.
Maybe we get you on next week and cover some of the issues that we had talked about, but it's just a crazy morning with 9/11. We have the postmaster waiting right behind you in the KUAM News Zoom room. So, Chima, closing message as we struggle with this surge. You are the containment lead for public health and fighting the COVID-19 pandemic. What do you have to say to the people of Guam this morning?
Okay, there are a few things for us to do to take control. Like we always recommend. You avoid large gatherings, which is being taken care of by the executive order. Make sure we protect our vulnerable population and our and people with underlying conditions, and also protect ourselves, and make sure that we avoid the 3 C's: close spaces, crowded places, and close contact setting, like funerals and parties for now. And on the government side, we are still finding cases, isolating them, taking care of them, and contact tracing is ongoing, and we are still quarantining contact. So by doing this, we are really taking care of the island. So I think we just have to make sure that we follow public health recommendations and also build some level of trust, between us and the public, and we'll take care of this virus.
Thank you, Chima.
All right. Thanks, Chima.
Thank you.
Okay, stay safe.
Stay safe, my friend.
Thanks to you and your team.
I feel cool telling the containment lead guy to wash his hands, but wash your hands.
You need to wash your hands. All right. Thank you so much for having me.
Thank you, Chima. Have a great Friday and a great weekend. And we definitely appreciate the work you and your team are doing, okay? Thank you.
Okay, so we're going to go ahead and stay in the Zoom room. And many of you may have seen the story.
I think we're going to play it, actually. So if we could, that's okay.
Right.
We do have the Postmaster of Guam standing by. Day. And so we'll get to her in just a couple of minutes. But we do want to play this.